Yeah, I keep it to 7:30. That's not good for everyone. Yeah. Did I just cause anxiety to increase? No, you probably just so, could I get a volunteer to read the board or read the screen? Yeah? Okay. Yeah, good, right? So, thank you, first of all. Yeah. The human brain is pretty powerful, right? We know it's pretty powerful. The fact that someone can read that. I'm pretty sure this was like a meme on Facebook ages ago. I actually didn't develop this part of the slide, so this was my prior colleague, Mark Hennick, who loved these kind of things. But the human brain is pretty powerful, right? And this idea that it can make connections when typically there aren't connections there speaks to a process in the brain called neuroplasticity. How many people have heard of neuroplasticity, right? And typically we talk about it in very beneficial terms, right? So this idea that the brain, after injury, can actually learn how to heal itself or begin to heal itself and make new connections and new pathways within the neural network in order to overcome a deficit, right? So an example of this is that the person that everyone reads about in their psychology textbooks at like first-year university, Phineas Gage, right? The tamping iron went through his skull, and he was able to live for many years after that. And the brain was actually able to heal itself and make new connections after that tamping iron had caused a TBI, right? The idea that individuals that might be paralyzed for a certain period of time can overcome, whether it's paraplegia or sometimes less likely quadriplegia, right? And actually start to walk again or use their hands again after a certain amount of time, right? The brain is incredibly plastic. And so the longer we spend learning how to do something, the more likely we are to regain that ability after injury or after illness, right? The opposite is true as well, though, right? What do I mean by that? The longer we stay engaged in a state of poor health, the more efficient the brain gets at thinking that way, right? So when I talked about those cognitive distortions that I was, when we talk about anxiety, when we talk about depression, those negative thought patterns that we get engaged in, the longer we spend in those negative thought patterns, the brain gets really, really great at just starting to work that way. And it becomes that much harder to rip ourselves out of those thought patterns, right? And start to at least approach normalcy again. Right? So when we talk about psychological health and safety, I always think about it from the perspective of the leader in the workplace, right? And are you helping your staff either not engage in those cognitive distortions or enabling your staff to come to work and actually engage in the treatment that they're receiving outside of the office, right? And if you're not doing that as a leader, you're abrogating your responsibilities, not only as a manager, so legal responsibilities, but also some ethical and moral responsibilities you have as a leader, right? Because you're a trusted individual within the workplace. So what we talk about in the next hour or so is going to be pretty important from that perspective. So what is psychological health and safety? Well, it's addressed in something called the National Standard for Psychological Health and Safety. Right? How many people here have heard about the National Standard? Anyone? A couple? Yeah. So unfortunately, it's not mandatory. I wish it was mandatory because it's a wonderful standard. When we look at other jurisdictions like Australia, some places in Europe, they've actually taken a look at Canada's standard and said this should be mandatory and made it part of their occupational health and safety standards in their home jurisdiction. Or components of it. Right? They've obviously made it culturally relevant to them. But for us, it's still optional, right? So workplaces can optionally engage in the standard. It involves all levels and roles, right? So when we talk about adopting policies that address those 13 psychosocial factors, and we'll go over them in a second, it has to engage everyone, right? Because you can have a really great policy that's written, right? Management gets together, they write a great policy, and then it goes in a desk drawer, and employees never read it. Is that going to be effective? No, right? If employees get together and have a meeting at maybe a joint occupational health and safety committee meeting, and management doesn't buy into the plan, is it going to happen? No, right? So it really does need buy-in from everyone in order to function and in order to work. It looks to identify, manage, and eliminate hazards and risks of harm. We used an example earlier WMIS training, right? So workplace hazard information material system training. The same thing is true for psychological health and safety, right? So when we talk about things like civility and respect, how do we mitigate the risk of harm associated with poor respect or poor civility? And how do we help maybe eliminate certain just behaviors that are absolutely unacceptable, like racism, right? Or sexism, whatever it might be. It actively works to address known factors. I think I get a lot of buy-in from this group. I don't think I have to, really push this too hard with this group. Some groups I do. But I always say that when we're talking about addressing known factors, it's not just about singing Kumbaya together, right? What does that mean? Well, when I talk about things like civility and respect or organizational culture, right, sometimes I get this stare, and that workplace will go like, oh my God, who did we invite to talk to us, right? Like, what is he going to mention right now? And so I always say it's not about singing Kumbaya together, it's about actually looking at known factors that can be qualitative and quantitatively measured in order to produce a positive effect in the workplace, right? So these are things that we can measure. These are things that we can improve upon, right? We can engage in iterative quality improvement practices or procedures in order to improve the workplace, right? And it's not a static thing, right? So the minute we start to implement the standard, it's never just done, right? We're always improving. It's constant. The most important psychosocial factor, there are 13. We won't go through all of them because we really don't have the time. But the most important from my perspective is organizational culture. And it's the degree to which a workplace can be measured by 3 things. Those 3 things are trust, honesty, and fairness. So if I were to ask you what an example of trust is in the workplace, what would you recommend or what would you suggest? Trust. An example of good trust in the workplace.
Feeling like you can share certain things with your employer, I guess.
Yeah, so things will be kept confidential if you share them, right? What else?
Maybe you have policies in your workplace. Employees, staff should trust the policies that there is effect. If something happens, there's a consequences. It's not just going on the department.
So policies are effective, right? They're not just there to make a regulator happy or make HR happy. They actually work. There's a reason we have them. Yeah. Feeling safe, right? In what way?
Just knowing that whatever you say, you're not going to be in danger of whatever you say.
Yeah, good, right? Safety can mean a lot of things, and I think that's a great example. It can also just be you trust that your employer is taking occupational health and safety, physical health and safety seriously, right? So if you're working as a roofer and you're up more than 2 stories, you have the tethers that you can actually tether off to so that if you fall, you don't really hurt yourself, right? Or you trust that there's proper air filtration if you work with chemicals regularly, whatever it might be, right? What else?
Or also just feeling safe that your employer's opinion of you won't change if
Good,
you
right?
are being transparent about an issue.
Yeah, what if you come out of the office? Do you trust that your employer is going to treat you any differently if that occurs, right?
I guess that kind of matches off trust that you'll be supported.
Sorry, say again?
Trust that you will be supported.
Yeah, trust that you're supported in certain things, right? It goes 2 ways too, right? So we've said a lot of ways that employees need to trust their supervisors or their employers. Well, employers have to trust their employees, right? So, does anyone here have like a clock-in system at work? Like a punch card at work? Yeah? You do? Okay. For those that don't, your employers trust that you show up at a certain time and leave 7 or 8 hours later, right? Like that's a very basic level of trust. Our employers trust that we're not going to steal things from the workplace, right? Like I'm not taking home printers with me or computers with me, right? It sounds kind of silly, but there are workplaces out there that do not have that, right? Things are like, you can go to a workplace in certain places and the computers are locked to the desk, right? Because they do not trust their employees to not walk away with them, right? Or they don't trust their employees to not record certain things or take certain pictures, so their cell phones have to be placed in a locker. Right? There's multiple ways that trust needs to go both ways, right? It's not just employee to employer, it's also employer to employee. What about honesty? What's an example of honesty, good honesty in the workplace?
For managers, it is leading by example, not imposing authority, but earning it through own actions. Treating everybody equally and respect.
I went and saw Christopher Robin, the movie, recently. I love Winnie the Pooh. And there's a scene where they're all coming back. He was supposed to be working, but instead he plays with all the animals, right? Because Winnie the Pooh. And he gets back, and he's stressed out because he lost all his papers. And his boss comes in and with golf clubs and says, "Oh no, I was working all weekend," right? But he had the golf clubs with him, right? That's an example of really poor trust. I know it's silly. It's a Disney movie, but it's cool. I like it. This idea that we need to trust that our bosses lead by example. Right? Or that they're actually being honest when they say, "Listen, I'm working really hard. I'm working here because I'm here for you," whatever it might be. What else? It's another example of honesty.
I think employees are honestly sharing why they need the day off, or
Yeah, okay, that's good, right? So if you're taking a sick day, you're actually ill. You're not taking it to go to Canada's Wonderland or whatever, right? I know everyone does that. Okay, I'm not going to pretend that none of you have ever called him sick, and it was actually, no, you're going to a movie. I know it happens, but for the most part, we're pretty honest about it. What else?
at the time you spend in the office, how you spend it? Just every minute doing work, or just you're on your physical schedule?
Yeah, so I think that's two things. It's honesty and it's trust, right? So it's this idea that your employer is trusting that you're not suffering from what we would call presenteeism, right? Which is like me 2 years ago, November 2016, day after the election, and I'm Googling CNN to make sure the nukes aren't launching, because I was not experiencing a good mental health day on the 10th of November there, but right? So this idea that we're actually present at our jobs, right? So they trust that, and that we're also honest about our work, right? What else? A big one for me is always that I hope that my staff are honest with me when they're struggling, right? If I have staff or I have employees, I would hope that they would come to me and say, "Listen, I'm going to be late handing this in, putting this in, or delivering on this, right? Or I need extra help in order to get this done," right? That level of honesty is really important in a functional workplace. Yeah.
I don't know if this would make sense. An employer is open to hearing feedback from their employees, not taking from the stance that I know everything.
Yeah, feedback, right? We kind of talked about a concept like that earlier when I said, if you say you have an open door policy, actually have an open door policy, right? Actually say, people can walk in and come to you with issues. Don't say this isn't a good time, and it's never a good time, right? Even though you want to be the cool boss, say, "I've got an open door." No, you don't, right? We've all done that before. So those are all examples of good honesty. How about fairness? Treat everyone equally. Okay, that's a big one, right? So not just equality, but I think equity, right? So I think in the workplace, equity is especially important because we do have individuals that work with us that maybe need accommodation, right? It's not about equality of experience, it's about equity of outcome, right? What else?
I think transparency too. Being very transparent around procedures, hiring processes.
Yeah. There's one, probably not necessarily as relevant to this group right here, but if I go into a Fortune 500 or I'm working with corporate Canada, I always tell them, I can tell if you have good organizational culture just by opening up your books. What do you think I'm referring to?
Integrity?
Kind of. It's financial books, right? Their financial statements. I can tell if they have good organizational culture just by their financial statements. Is a woman in the same position as a man getting paid an equal amount? right? You can be hitting all these other things, but then a female VP is making $80,000 a year, and a male VP is making $300,000 a year, and you do not have parents, right? And that's going to cause issues up and down throughout the organization. And that is an easy way. It's the first thing that I would tell any organization to do is open up your books and make sure that women are getting paid the same as men, right? So we can all think about some things, right, that contribute to trust, honesty, and fairness, right? And really, these things predict positive and productive social processes, right? When we trust one another, when we're honest with one another, and when we treat one another fairly, the relationships tend to be pretty good, right? People tend to work well together. They're not bickering with one another. They're not getting in fights. They're not leaving work regularly, right? They're working productively together. It's a predictor of cooperative behavior, right? Organizational citizenship, I'll come back to that point in a second, commitment and loyalty. Why do you think I use the term organizational citizenship?
You feel like you're a part of the organization, the outcome.
Just buying into it, right? Just buying into the work that you're doing and the organization's, whether it's vision or mission, right, or culture, right? You're a good organizational citizen, which means that you speak up when something isn't working out, or something is wrong, or something is bad, or something is unethical, right? You're actively engaged in the health of the organization. That's what being a good organizational citizen means, or a corporate citizen, or however you want to say it, right? You don't just want employees. If you're a manager or you're an employer, you don't just want employees that show up to work, clock in, and then clock out. Those are not great people to have at work, right? You want people that are really engaged in the work, regardless of what you do. Don't care what it is, right? You want people that love being there and love the organization. And finally, I want you to think about, what does your organizational culture look like, right? Are there things that you could improve, whether it's something to do with trust, something to do with honesty, right? Do you find yourself constantly having to make excuses for sick days or something like that? Is there something unfair about the workplace? Are people being treated unequally, right? Or inequitably? Right? And it can be simple things. It doesn't have to be something major. It could be something like, you know what, Sally always gets Christmas off. Let's say you have to have people in the office at Christmas. Sally's always getting Christmas off. I've never gotten Christmas off in 10 years. Right? And that could be an example of not having a very fair workplace. Right? Civility and respect is another psychosocial factor, okay? Probably from my perspective, the second most important, so it's second. And it's really a work environment where employees are respectful and considerate within their interaction, right? It's a pretty simple start state, right? Like it's not all that complex. What are some ways in which a workplace might not be civil or respectful that we've encountered before? Yep.
Telling something to your employer, like something that happened, and then everybody finds out about it in lunchroom.
Yeah, that's a big one, right? So disclosing to an employer there's a concern, and then all of a sudden everyone in the office knows about it, right? Not only is that a breach of trust, right, but it's also really lacking respect for the individual, right, or the respect for that individual's experience. What else? Yep.
Like an employer is talking to one of the staff about other staff members.
Yeah, right. So talking behind some other people's back, or you know.
So that I'm protecting them.
Yeah, exactly, right. So civility and respect; those are some pretty basic assumptions that, you know, when I say something to the boss, it's going to be kept with the boss, and they're not going to announce it or tell it to other people, right? It means showing esteem, care, consideration, and acknowledging dignity. So it goes a bit beyond just like being respectful in your interactions, right? Like treating people fairly and nicely, but also treating people with dignity, treating people with care, right? Adopting an ethic of care in the workplace, if you're going to use terms around ethics and stuff like that, right? I think an ethic of care is an excellent ethic to have. When we talk about acknowledging dignity, what does that look like? So a while ago, a few months back, I was having a conversation with a gentleman named Jamie Watt. Who knows who Jamie Watt is? So Jamie Watt is the principal of Navigator. It's a consulting firm here in downtown Toronto. He used to be a consultant for the Mike Harris government, so a pretty conservative guy, right? And him and I were having a conversation around organizational culture, civility and respect, right? It was just like a lunch meeting. It wasn't, I wasn't in there trying to reform the organization's culture. And we were in his office, and he said, you know what, I really hope that I'm living these things in the work that we do, right? Despite the fact that he's a crisis management firm, right? And I said, well, how do you mean? And he said, well, he took me around on a tour of the office. We went back to his office, and he said, you know what, I have gay employees, I have lesbian employees, I have employees that are HIV positive, I have trans employees, I have employees who are refugees, I have employees who are immigrants, I have employees that this is their first decent job, right? And I really hope, despite that entire, that full scope of all the types of employees we have here, I really hope they can bring their whole selves to work. And I was kind of taken aback because I wasn't expecting this from him. In our previous interactions, I wouldn't have expected it. I said, can you expand on it? Your whole selves to work. And he said, I want them to feel comfortable being themselves. I want them to feel as though their identities have dignity. There's an inherent dignity to their identity, and they can be like that in the office, right? And so he talked about the fact that, if someone needs a gender-neutral washroom, well, who cares? That's just money, right? Give them that. Or if someone needs time off in order to go get methadone treatment, who cares? Just give them that, right? This idea that they're a whole person, they're a human being, and that should be the place we meet them at, as opposed to requiring them to be something else before they're a human being, right? And I was just blown away, and I thought that was an excellent example of civility and respect in the workplace. Just that simple term, bring their whole selves to work. I don't want them to be anyone different. I hired them for a reason. Right? And so when we take a look at our hiring practices, when we take a look at how we treat other individuals in the workplace, we're hiring the people for a reason, so let them be their whole selves. Right? Because you interviewed them, hopefully, as their whole selves. Right? This improves job satisfaction, perceptions of fairness, right? This idea that when we're trying to take care of fairness, it's actually perceived as being fair, right? That we have good morale, good teamwork, right? Civility and respect it affects everything, right? Not just our interactions with one another. So an accommodation. I handed out a package. Every table should have enough. If you don't, I've got spares. That lists some common accommodations. But before we get to those, and we go through a bit, and we workshop a couple, I want to make it very clear that, first of all, accommodation, or the precept for an accommodation, is this idea that we have a right to equal treatment in employment. Right? So how many people here can name some physical accommodations that exist in this building, for example, in this workplace, that you've seen throughout the day? I've seen at least 20. Yeah? Yeah, good, right? So.
Some prefer allow me to have provided for staff that are.
Yeah, so that's an accommodation. It could be that if we know someone has a severe allergy, maybe food. I'm not sure, but maybe that type of food wasn't ordered. That's an excellent example. What else?
Person with wheelchairs, is wheelchair accessible?
Yeah, this building is wheelchair accessible, right? So there's a ramp outside. There's push buttons on the doors. They're automatic. There's an elevator up to upper levels. What else? Yeah.
There's a
Braille, yeah. On all the signage, there's Braille. What else? I can see it in this room. Adequate lighting, but more importantly, if you look up in the ceilings, right, you'll see two things. You'll see the fire alarm lights, and you'll see the speakers for the fire alarm, right? So if there's two types of signal or cue, that there might be a fire in the building. Right? That's a pretty important accommodation. Everywhere has to have that. What else? That it? Yeah?
I'm up for when fire happens, not the incident.
Yeah, good. That's a version of an accommodation, absolutely. There's some other big ones, right? So if you were to go down to the gym, you'd see accommodating equipment for individuals that might be in wheelchairs or might not have full range of mobility if they want to come in for a workout, right? There's accessible parking spaces outside. You're going to see on the steps are a certain height, and the reason for that is because individuals that might have mobility issues can't raise their legs as high, right? Especially with something like drop foot. There's tons. There's at least 100 accommodations in this building alone, or different types of accommodation in this building alone. What if I asked you what an accommodation for depression is? What might that be? It's hard, right? It's hard to think about. Like, what's an accommodation for depression? Part of the reason why it's hard is because, first of all, we're not trained to think or notice these things, but also because there's so many, right? There are a lot, and we're going to go through a few of them and workshop those in a second. It's this idea that we can't be discriminated against or discriminated upon because of our employment or our actual or perceived disability, right? So an actual disability is the actual disability that you're experiencing, right? You can't be discriminated upon because of that. But also the perception of disability, right? So if I were to come to you and I'm an employee or a prospective employee and say, I've recently been diagnosed with schizophrenia, you might get anxious and say, well, can you actually engage in this work, right? And that would mean that there's a perception of disability when there might not actually be one, right? We have a duty to accommodate up to the point of undue hardship here in Ontario. Does everyone understand what that means, the point of undue hardship? Yeah. So essentially, your organization has to become fiscally insolvent in order for you not to accommodate an employee. There's one case in common law currently where an organization successfully argued that they could not accommodate the employee. Only one case. So organizations that think that they can go to courts and claim that they're meeting the threshold for undue hardship, it's not going to happen, right? And the reason for that, especially when we talk about mental health, is that the average cost of an accommodation for mental illness is under $500. Under $500. They are not expensive. It's really important that you review the healthcare provider's report on limitations, understanding two things. The first is that you're not entitled to a diagnosis, right? So you will not see on that report of limitations, Sally has depression or Sally experiences bipolar disorder. You won't see that. You'll see a report on functional impairments or limitations based upon the diagnosis that was received, right? The second is that you cannot mandate a treatment plan, right? So what does that mean? Well, how many people here have watched the TV series Intervention? A few? I don't think it's on A&E anymore. It's a terrible show. I hate that show. But oftentimes you'd see on the intervention there'd be an employee there talking about, I was ordered to attend AA meetings if I needed to continue to work, right? That's a pretty common thing we hear about in the news media or wherever. You can't do that. AA is a treatment plan, right? You cannot mandate as an employer that your employee go to AA meetings or go to inpatient treatment, whatever it is. You can mandate that the employee does not engage or is not inebriated during work hours, or does not consume alcohol during work hours, and they might decide, you know what, the best thing for me is to go to an AA meeting, but you can't mandate that treatment. If you have an employee that was, say, destructive in the workplace, right, maybe ripped something off a wall during a period of active psychosis, you can't mandate that that person takes their neuroleptic medication. What you can do is set a reasonable expectation on their behavior in the workplace and say it's unacceptable to destroy company property. And then they might decide, you know what, in order to not do that, I need to take my neuroleptic medication, but you can't mandate that they do that, right? So you're not entitled to a diagnosis unless they disclose to you, which is fine, they might, and you're not entitled to commit them or order them into a treatment plan or program. When you take a look at that form right there, right, so it should read at the top, making mental health work accommodating mental health problems and illnesses, right? You're going to see a list of some common accommodations based on the type of functional impairment that you were likely to see on a report on limitations, right? So for example, if the challenge is maintaining stamina, varied tasks throughout the day might be an accommodation, take longer breaks might be an accommodation, right? So these things are inherently cheap and pretty effective and easy to implement, right? If the issue is concentration, you might see break large tasks into smaller tasks, right? So chunk out the work. Play soothing music, right? Sometimes that helps for individuals, if that's the case, yeah.
So these providers report on limitations. Is the employer allowed or entitled to request it?
Yes, okay, so you are entitled that.
From the care provider, okay.
Yeah.
The doctor.
Yeah, so here in Canada, and here in Ontario specifically, if you are an employer and an employee comes to you and says, I need an accommodation, right? You have two options. You can either just assume that, that this is a valid accommodation, or what you can say is, listen, we need a report on your limitations in order to effectively accommodate you, which is often the case, and they need to go to a medical provider and get that, okay? If there is a cost associated with getting that report done, you bear the brunt of the cost, okay, as the employer. Sometimes there is, especially if there's like a psychosocial assessment or something of that nature that needs to be done. If you don't trust the doctor that they go to and you want to get a new doctor, you might have to pay for that, which means that you're paying for it, right? But you are entitled to ask for a report on limitations or a report on functional impairments from a physician or from a professional if you need it in order to accommodate the individual. That doesn't abrogate your responsibilities to accommodate before you receive that, though, right? So if the individual is claiming that they really need this in order to work, and it's going to take 4 weeks before they can see the specialist or whoever, you still have to meet them at that accommodation prior to them getting the appointment, right? Because then you might be constructively dismissing them if those 4 weeks they don't have an accommodation, right? That would be considered constructive dismissal. Yeah. Does that make sense to everyone? Right. So that form that you have there, that sheet that you have there, it's meant to be a guidebook. It's not meant to be a final product or give you every solution or be a panacea for the issues that you might see in the workplace, right? What I will say is in the next 2 weeks, we're going to be publishing a guide for managers on accommodating mental illness and addictions in the workplace. That will be accessible on CMHA Ontario's website, and you can also email me and request a physical copy and we'll send it to your workplace. Okay? So that's for managers looking to accommodate staff. The next is return to work, and return to work is really a critical time to support the success of any organization, of any employee that is requiring an accommodation. It should be viewed as an accommodation, which means that when an employee is looking to leave the office, there's something going on, right? Is a return to work process, is that them taking a vacation? Are they going to Barbados as part of that? No, right? They're doing it because they're getting treatment. So there's a few key steps that you need to take, okay, and understand that you need to take before they go on a leave. The first is that you need to plan the leave with them, right? So if at all possible, you need to meet with them and say, how long do you need off, right? When do you want to do our regular check-ins? Because you should be checking in with them while they're gone, right? Do you want that in person, or do you want that over the phone or over email, whatever they're most comfortable with? And the most important thing, even if they don't ask it, is you give them a copy of what the essential duties of the job are. Why do you think that is? Why are you giving them a copy of the essential duties of their job before they go on leave? Because they're going to take that to the psychologist that they're working with, the social worker that they're working with, or the physician that they're working with, and they're going to say, I need to accomplish these things and be able to do these things when I go back to work. Right? It's their roadmap to getting well again, or well enough to come back into the workplace. If you don't give them that, then they're really going to have a hard time just guessing what they need to be working on, right? So give them the essential duties of the job before they leave. Plan the return, right? So ask some pretty particular questions, like how can I help you be successful? So what accommodations are you going to need when you get back? Or if you don't know right away, can we make sure that we do a check-in before you come back so that we can implement them when you return, right? What are you going to do to ensure success, right? So how long do you need to be gone for? If there are incidents in the workplace or issues with behavior or performance, how are you going to rectify those, right? And then certainly have a safety plan, right? So how are we going to deal with future issues? That might be future disruptive behaviors or inappropriate behavior in the workplace, but it could also be how are we going to deal with issues if, for example, you experience another episode of psychosis, right? Who do we call? Do we call your mother? Do we call a friend? Do we call your spouse? Who's your contact person that you want us to call? If we're concerned about your safety, who do you want us to call? Right? So these are all questions that you should ask of employees to make sure that you have a safety plan and a response plan in place in case there is another concern. Right? Any questions about that? Pretty straightforward. So what does psychological health and safety look like? I get a question often about what's the first step. So how many workplaces have started to implement the national standard? Are there any here that have started to implement the standard? Okay. Is that a hand saying yes or no? That's just yeah, no, that's okay. All right, so I would really recommend that you take a look into doing it. First of all, it's inexpensive. Second of all, small and large organizations have been doing it, okay? And third, there's actually evidence that it's effective and it works. And the evidence for that is the case study research report put out by the Mental Health Commission of Canada about 3 years ago, reporting on all the organizations that had actually implemented the standard in the first 5 years of it existing. Right? A great resource for any organization is the Guarding Minds at Work website. Has anyone been here before? No? Okay. So Guarding Minds at Work, it's a free resource. All right? So the The standard is a bit opaque. It's a bit difficult to dissect, especially if you're not used to implementing certified or accredited standards, like an occupational health and safety standard or stuff like that in the workplace. It can be a bit difficult to navigate. And organizations actually pay big money for advisors to come in and help them implement. But Guarding Minds at Work is something that you as a manager, or you as a staff member can actually go to and learn about how to implement the standard and how to make effective change in the 13 psychosocial factors. So the first thing to take a look at is obviously about Guarding Minds at Work, what is psychological health and safety, right, and how to use it. The best resources, or the thing that I think is really great about this website, because they make it all accessible, is that they give you the tools that you need in order to implement the standard and address certain psychosocial factors. So, for example, if you just want an about for, let's say, PF3, clear leadership and expectations, right, you can get that. Do you want an assessment tool for it? How to measure it in the workplace? You can get that. Do you want suggested response documents in case there is a concern in the workplace or there's been an incident in the workplace? You can get that, right? Action planning workshops, right? Or worksheets. And then finally, evaluation worksheets, right? So how do you evaluate it between staff or amongst staff? Just pull that up. So this is an example of an evaluation worksheet that you'll find at Guarding Minds at Work if you're looking to implement the standard, right? Typically, you would use one of these after a joint occupational health and safety meeting, determining that, okay, of the 13 psychosocial factors, this is one that's of large concern to us. Then you would take a look at how it's been scored, right, based upon the evaluation worksheets that you've used. And then you would set an action plan on how to improve, right? And then set a date for the next iteration of actual assessment. Does that make sense to everyone? Kind of, yeah? I know it's pretty opaque. You really need to take a day or so and go through the website in order to get a good handle, first of all, of 13 factors, but then also how to adopt and engage in an assessment process. CMHC Ontario is prepared to offer you advice or pathways forward if you're looking to implement the standard. So all you do is you email me and say, we're looking at taking this leap. And then I say, great, here's what you need to do first. And then you'll be really frustrated and it'll be miserable for a little bit, but it'll get better, right? Because it is difficult to do, but it's worthwhile. So, just in your groups right now as a table, what I'd like you to do is I'd like you to think about and assume an individual or an employee is struggling with anxiety. Okay? And in the next 5 minutes, I want you to come up with a list of symptoms, okay, of anxiety, and then for each corresponding symptom, at least 2 potential accommodations that you might give to that employee. Okay, so just in your groups right now, take 5 minutes, and then we'll talk about those afterwards. And feel free to use the resources that I handed out if you're stuck on something. Oh, okay, yeah, sure.
Because then we can look at it.
Okay, perfect. Use the microphone. Where's the spare? Right there. Okay.
I don't know if I should leave her. I mean, she once said she could.
Yeah? Okay, sure.
Okay. But since it's not.
Yeah, but yeah, I'll make sure.
Okay.
so I think we're going to pull back into the center here. And I'd like one of the tables to volunteer to list off a couple of symptoms that they thought about in the context of anxiety, and then a few of the accommodations that they thought would be a good response to that. Okay? Just put use the microphone. No, because we're recording, so. Okay.
So we were saying like sweaty palms or like feeling overwhelmed. So implementing or accommodating that by having more breaks, and keeping up with that, ensuring that is taking place, not just saying it but putting it into action.
Yeah. Okay. So walking the talk is important, but feeling overwhelmed and then having more breaks, that's a pretty common one and actually a pretty excellent accommodation. How many workplaces here have set break schedules? Like you can only take them at certain times. All right, that's okay, but it might not be as effective for individuals that might need the break when they're experiencing high levels of stress or anxiety, right? Because you can't tell people, okay, your panic attack's going to be at 10:15 and 2:15 every day, right? So allowing them to take the time can be a really powerful tool. Yeah.
We also discussed some anxiety symptoms that might come out of the workload.
Yep.
Or stressful, handling stressful cases. And we were talking about like ensuring that there is briefing sessions or somebody to brief with, putting a clear role for individuals within organizations, and being aware of who should I address or who should I approach when I have this or that.
Is your organization involved in case management?
Kind of.
Yeah. Okay. So that's a really great tool, and I encourage any organization that has whether it's case management or client care, adopt the buddy system. Okay, which means that you have someone that you're able to debrief with after a really difficult client or after a really difficult case. I saw a hand up here. Yeah.
I supervise teachers and childcare workers, so to give them different break times, we do have a set break time. So it's quite difficult. And I know in our organization we do have settlement workers, we have a lot of different staff, so sometimes the breaks, we're not able to do that.
No, and that's understandable, right? So there's examples, and I always get pushed back. Let's say I'm in a factory and there's an assembly line, right? You can't just have one part of the assembly line decide to take a break at a certain point in time, right? The entire line has to take a break. Absolutely, the type of job is going to dictate that, but if at all possible, if the organization does not require due to operational reasons, then allow employees to take breaks, a half hour a day whenever they need them, right? If that's the case, then it's up to working with an individual staff member and coming up with a workaround. Sometimes it means having a second person on staff take over quickly in case there is going to be a concern, but then you're looking at an individual accommodation rather than a company policy that can actually be quite effective. Yeah. But thank you for bringing that up. That is pushback, I guess, sometimes, and that's absolutely understandable. Okay, what else? Who else had some symptoms and some accommodations that they had suggested for those?
Well, actually, one of my teachers, most of our classrooms have windows. They don't open, but we do have a very two classrooms that are quite dark and kind of dingy, and I guess not dingy, but they're older and they haven't been renovated. And one of the instructors have been in that space for many years. And when we tried to move her there a couple of weeks ago, just on a temporary basis, she panicked. And so we had to sit down with her, and she said, no, I can't work in that space. There's no windows. So we had to then come up with an alternate plan.
Yeah. So sometimes just changing the work environment is a pretty powerful tool as well, right? That costs no money, or that doesn't really have a huge impact on the operations. If you work in a cubicle setting, right, and let's say you place someone in a high traffic hallway in that cubicle, and they just get really anxious, people walking behind them, then just put them in a corner, right? Put them into one of the corner cubicles, or move them into a private office, or in an office with maybe only 2 staff, or something like that. There's multiple ways that you can ensure that the workspace is conducive towards their health.
Yeah, so we got a volunteer to paint to do some different.
And that sometimes is that too, right? Sometimes just changing how the environment is laid out or what exists in the environment. What else? You might be close enough, but just in case.
We talked about feeling withdrawn or that type of symptom, and we just had a discussion around peer support or sort of adopting that buddy system where you might be able to connect with someone within the office that you feel comfortable to speak with and just to maybe debrief and whatnot. Also, just normalizing seeking help and like having the employers maybe communicating with staff that you should be calling EAP or there are ways that you can access counseling services and whatnot and making those accessible to staff.
Yep, excellent. Right, so you had an accommodation there, and then you also had a policy that is protective in nature, right? So normalizing your benefits, talking about your EAP at regular meetings, right? I would say overwhelmingly the biggest issue with lack of EAP use or lack of benefits use, or staff just don't know how to do it. They don't know what number to call, or they don't know like what the process is to ask for reimbursement for psychological care or whatever it might be. So if that's the case, then what you should do is have a session at the next staff meeting about this is how you access the EAP, right? Or this is how you access your benefits package, right? This is the process you go to. Here's the website. Here's how you enter the form. One thing to be cognizant of when it comes to benefits is most providers are on a reimbursement basis, right? So they don't pay for the provision of care. They pay after you've already paid out. Typically, only dental care is covered by most providers prior to you going in. If that's the case, be cognizant of the fact that you might have staff that are just prohibited from accessing their benefits package because they don't have enough cash in the bank to go and pay the psychologist ahead of time. If that's the case, then you should look at internal company policies about giving, whether it's advances or stuff like that, if they desire to use it, and then having a process in place for that to occur, right? Because depending on the type of practitioner, they might not be able to do direct billing. So if you have an issue like that, then make a note of the staff that, hey, we have an ability to ask for an advance, and all you have to do is provide a receipt. You don't have to, you can black out or speak to HR about what the receipt was for, depending on the policies in place of the workplace. So just be cognizant of that when you talk about benefits. Anyone else? No? Okay, moving on. So just like we can place individuals on a spectrum, we can place workplaces on a spectrum, right? And a workplace that is well balanced, the disc is going to spin, right? It's in the center there. And that's a workplace that we would call productive. We call it engaged, healthy, and open, right? We've all probably worked in a workplace that was pretty close to that. Maybe we're currently working there. But alternatively, a workplace that is maybe starting to experience a bit of concern is one that might feel unmotivated, right? We feel as though we're just not motivated to show up, or the work is just draining, right? It could be a workplace that feels tense or scattered, like there's no direction, right? If that workplace spends too long in a state like that, then it might move into a workplace that's in crisis, right? And this is the kind of workplace where we would describe it as toxic, like it's slowly poisoning us every time we enter it, right? Burnout's occurring, right? So people are just coming in, working really hard, and flaming out, right? After a few weeks, few months, a year or two. Injuries occur in workplaces like that, right? Not just psychological injuries, but physical injuries, right? So people aren't paying attention and someone's foot gets run over by a forklift. Or someone gets in a car accident because they're so overworked they haven't slept, right? And finally, workplaces that experience incidents are workplaces that are in crisis, right? So workplaces that continuously have incidents occur at company parties, or there's problematic drinking every Christmas, at a Christmas party, whatever it might be, those are workplaces that are not experiencing good health at that moment, right? Because workplaces that are healthy do not experience those kind of things. Would anyone add anything to a workplace that's in crisis that they've seen or maybe heard about?
Some would lead to high turnover.
Yeah, high turnover, right? So just a revolving door of staff, absolutely. Big one's not up there, but maybe under oppressive, but abusive, right? Abusive behavior in the workplace. Belittling behavior, right? Behavior that's absolutely unacceptable. Racism, sexism, stuff like that. Healthy workplaces do not experience that, right? So there's a legal case for this. Here in Ontario, we have the AODA, right? And there's a process in place in order for you to engage with the AODA and ensure that you're within compliance. It's called the Accessible Employment Standard. How many organizations here are under 6 staff, or under 50 staff? Probably all of you. All of you are under 50. Any over 50 staff? Oh, really? Okay. So organizations over 50 staff are considered large organizations. You have to implement all 6 factors of the Accessible Employment Standard. Organizations under 50 only have to implement 4. The 4 that everyone has to implement are accessible hiring practices, right? Which means that you're advocating for individuals with disabilities, or advocating to individuals with a disability that they will be accommodated during the hiring practice. It means having a performance management process in place that is accessible to staff, right? So that you might have ASL translation come in for performance management or for performance reviews. You might have a staff member submit questions to ask the boss ahead of time if they suffer from severe anxiety, right? If there's workplace policies that need to be communicated, those are communicated in an accessible format, right? That's one of the other 4. And then the final one is workplaces are required to have, if you have an accommodation policy, it has to be communicated in an accessible format, okay? So those are for all organizations. If you're larger than 50, then you also have to have an accommodation policy, a written one, and then you also have to have a return to work policy and procedure in place. Okay? If you don't have those, you're not in compliance with the AES. That being said, I encourage every organization to have an accommodation policy and to have a return to work policy. And the reason for that is the last thing you want to be doing when someone asks for an accommodation is figuring it out as you go. Right? That's not helpful to you, that's not helpful for them. Have a policy in place and have something thought out so that when someone comes to you and asks for it, you're able to say, okay, these are the steps we need to take. Because that's going to limit anxiety on their part, and it's going to ensure that you're doing a good job with the accommodation to begin with. Emerging legal requirements for the protection of employee psychological health and safety. Right? So here in Ontario, we talked about the AODA. That's becoming pretty common across jurisdictions, regardless of whether it's Ontario or Alberta. And then from a national perspective, the feeling that we're getting is that overwhelmingly we're going to see something similar to the ADA down in the States, right? So the Americans with Disabilities Act. We think that's going to occur in the next few years here in Canada. There's a liability for the infliction of mental suffering on your part as just a manager. Okay, so not only can the organization be considered in breach of someone's rights, whether from the Human Rights Code or under the AES, but individual managers can as well. Right? So you automatically assume, when you're a manager within an organization, certain responsibilities, and you can be found to be abrogating someone's human rights or someone's rights under the AODA if you don't take care of those. Right? So it's important to understand that as managers too. Right? You can be held personally liable for certain things and certain behaviors. Not to scare you, but typically these behaviors, right, they're pretty severe. So things like racism, sexism, harassment, abuse, right? Just following company policy is probably not going to get you into individual liability. And collective agreements have been deemed to implicitly include the terms for psychological health and safety in the occupational health and safety stipulations within that agreement, right? So if you're a unionized work environment and it talks about occupational health and safety, it's implicit that psychological health and safety is included in that, right? Big changes to the WSIB recently, right? So chronic stress, now a claimable or insurable injury as under the WSIB. We've seen changes to how the human rights tribunals are interacting with issues surrounding accessibility and mental illness, right? And I had mentioned earlier the finding out in Elliott Lake with that the only organization that we can find that successfully argued that they had met the threshold for undue hardship, right? So any questions about that slide? No? Pretty straightforward. Kind of that's the stick part. I've already given you the carrot. There's also a human rights case, and this is obviously important, right? Overwhelmingly, we still see employers treat individuals with depression abrogate individual depression to human rights, right? We tend to treat them as though they're lazy, or that they can't hack it, or that they're just not meeting deliverables, right? This is common. Despite the fact that we have things like Bell Let's Talk, and we have sports stars talking about depression like DeMar DeRozan, and we have, like, for lack of a better term, it's insane that that's still happening, but it does, right? People with depression are still discriminated against. And then courts across the country are adding the obligation to accommodate mental illness in the workplace, right? And here in Ontario, that's certainly the case. So you can't abrogate someone's human rights based on the fact that, well, you have a physical health and safety program, not a mental health and safety program, right? You have to have both here in Ontario. The business case, we talked about the return on investment. I really want to hammer this home. It's up to you as leaders in the workplace or in your communities to start to think about these things, right? Just saying that you've never been taught isn't really good enough. You have to teach yourself. And if there's concerns about your level of knowledge when it comes to psychological health and safety, then seek out that information, right? There's numerous resources, apart from attending a lecture or a seminar like this. There are numerous resources that you can be attending to or accessing in order to help address these issues, right? And there are numerous community organizations, like the CMHA, that can help you along the way in implementing psychological health and safety in the workplace, right? The national branch has a great program called Not Myself Today. You get cool buttons, and you wear the buttons, how you're feeling. It's an advocacy campaign, right? I really encourage you to take a look at that. You can access psychological health and safety reps through CMHA as well. There's multiple forms of support that you can access through CMHA, okay? Benefits, right? Higher job satisfaction, attachment, and performance. People are going to want to show up to work. You're not going to see presenteeism, so people are actually working while they're at work. You're not going to see burnout, or people are going to stop taking as many sick days, right? Because we can take sick days for mental health days, right? It's the same thing. You're allowed to do that here in Ontario. And you're enhancing team learning behavior, right? So every organization is a learning organization, and you're enhancing that behavior within individual teams when you take care of this stuff. Finally, some resources, because I want to leave it open to questions for about 10-15 minutes. First, obviously, access your local CMHA. So how many people here are from Toronto? A few? Okay, so you have access to CMHA Toronto, obviously, as well as CMHA Ontario. It's headquartered here in Toronto. Anyone here from Peel region? Okay. CMHA Peel Dufferin is your local branch. Anyone here from Richmond Hill? No? Markham? No? How about Barrie? No? Anyways, my point is there are 30 branches across the entire province. Any community within the province of Ontario has a local CMHA, or access to a local CMHA.
Do we have one between like Markham and Richmond Hill?
Yeah, so that'd be York South Simcoe. Yeah. Yeah, Durham has a CMHA. It does. And so there are 30. If you're having trouble accessing it or locating it, please reach out to me, and I'll connect you with your local branch. Next is obviously Guarding Minds at Work. I showed you the website. Please take a look at that website after today. Give yourself some breathing room, like do something different tomorrow, and then maybe on Wednesday, take a look at the website and look up the national standard and those 13 psychosocial factors. The two things that I really plug at any talk that I do, the first is assist training. So a couple of you mentioned that you had it. Every workplace should have someone with applied suicide intervention skills training. Okay, every workplace. There are very few things that I look back on and have a lot of difficulty talking about. And the one thing that I wish I had a long time ago was assist training, because dealing with that in the workplace is horrific, absolutely horrific. And if you can do something to mitigate that, then you should be doing that. And assist training is one of the ways that you can do that. The next is mental health first aid. And that's just like doing your St. John's ambulance, except for mental health concerns, right? It's a 2-day, I think it's 2 or 3 days now. And you go in and you learn all about how to interact with individuals that might be in crisis, right? Or might be experiencing a particular mental health concern, whether it's psychosis or mania or high anxiety or depression. You'll learn all of it. So that's a great tool and resource to have in the workplace as well. Thank you for listening to me for 6 hours. And being at least relatively interactive. That was awesome. I usually get a lot of eye rolls when I say role playing. That you took it to heart. Any questions from you here. And we are going to ask that you use the microphone because the people on the web. Yes, no, maybe? Yeah, absolutely. So, for my contact information, by the way, my business cards were pretty popular. I got to reorder more. So, unfortunately, you're going to have to send it to the bulk email. However, I get all of those. Usually we have an email here. I'll write it down. Hold on. So it's just lblake@ontario.cmha.ca. So this is my personal email. It comes right to me. Usually we have an info@mentalhealthworks.ca. That comes to me as well, just different box. Any other questions?
It's not a question, it's just a comment.
Remember when we started to think about accessibility and all these agencies? I'm talking about my agency and my area. I'm sure that every agency has this kind of issues. Accessibility, like putting the ramp that wheelchair people can come, opening the hallways that wheelchair people and then people with walkers or washrooms. It's cost. There is a cost involved. We learned so much today here, and then I'm just thinking about to implement nicely everything related to mental health. We have to have a backup, you need the resources, you need funding, you need people to work with you, you need HR you have to get everybody involved and buy in and be on the same page. And it takes time, and I know that this is really, you said some of them we must have, and I agree with you, we must have. But others, we learn so much here, but when we go back, our hands are tied, we cannot do anything, everybody is busy, and then overwhelmed, and you know what, honestly, it brings anxiety to me as someone that, lead the organization or department.
That's a great point. So I think the question, where to begin and how to begin and what's the next step is absolutely legitimate. What I would say is there's one takeaway, right? Because you're not going to go back to work tomorrow and be really keen and download the national standard and say we're implementing it by Thursday. That's not going to happen. Right? First of all, it's not realistic, and second of all, it's just you're busy. Right? If there's one takeaway today, it's your interactions with individual staff or colleagues, or clients for that matter. Right? It's how you interact with those people. There's a reason why if I were to go into your workplace as an individual workplace, and before we do the assessment about where your workplace is at, most of the time I say, you know what, we're going to spend a day and we're role playing for most of the day. Because that's what they need. They need to understand how to develop and inculcate those skills within the management team to be able to have a conversation with a staff member that might be difficult. Right? Especially if you come from a background that's not used to talking openly about things. Like most people from my background, right? We're not good about talking about feelings. It's pretty difficult for a lot of people like me. And so just teaching and training people how to do that it's the biggest takeaway, right? Being able to have an open and honest conversation with your staff. And that's the first step. And then your staff start meeting you where you're at, and you start meeting your staff where they're at. And the great thing about accommodations for mental health concerns are they're pretty cheap, overwhelmingly, like under $500. I'm talking like noise-canceling headphones, or just moving someone into a different space in the office, or letting someone come in a bit later every day and they leave a bit later every day. Those are all very simple accommodations, right? You don't have to widen the hallway or put in a ramp. None of that. Yep.
So my question is, it is known that racialized communities are disproportionately affected when
wondering, as organizations are developing mental health programs, are there any partnerships that CMHA is developing and working with organizations on the grassroots in terms of developing these programs with them?
Yeah, so absolutely. So great question. CMHA, it's a community mental health provider. Okay, it's an association. So we have branches, we have divisions, then we have our national headquarters, right? We're a federated structure, which means that the locus of control or the line of operation for an individual branch is going to differ entirely from the next branch, even just down the street, and will differ from the Ontario division. At Ontario Division, we regularly partner with community service providers that work with racialized or newcomer populations. We certainly did that when I sat on the special advisory table for refugees, when we committed to continuing that work with partner organizations that were sitting on that table. So that's constant. And our local branches consistently interact with community service providers at the branch level, right? So our branch levels provide direct client care. At Ontario Division, we tend to work on policies and we tend to do training like this. Some recent examples of partnerships that we've engaged in are partnerships between Living Life to the Full, which is our older adult caregiver program, and Hong Fook, and translating that into Mandarin. Another recent one is Bounce Back, and the translation of Bounce Back programs and services into multiple languages through community service providers that were experienced in delivering that program in a culturally accessible way to certain communities here in the province of Ontario. So we regularly do that. And if you have an application you're putting in, or you have something that you want to work with us on, then I'm more than happy to either work with you on it or refer you to someone at our policy department that's probably going to be really keen to do that as well. So absolutely, that's a full stop yes on my part. Any other questions or? No. Fine. If you do have a question and you think about it later, just email me and I'll either answer it or refer you to someone who can. Okay? I won't leave you hanging.
So I want everyone to thank, or I want to thank Lawrence Wade for and just a few more things before you guys leave. So we have bags of food from lunch that's left over, so you can take some there. Also, before you leave, if you could just write again one word of what you learned today on the chart paper before you leave, that would be great. I mean, it's 4 to 10, so if you could take 5 minutes to do that, and maybe interact with some of your colleagues here as well. And then I think that's it for today.
What I will say is, if there are questions from the webinar, if they want to type them and you send them to me, I'll type out the answers.
Okay.
If you want, it's your call, but I've done that in the past. So, yeah. Okay, perfect. Yeah, that's fine.
Also, we will be sending in